Today we will be talking about eating disorders. We understand that this can be a very difficult topic for some people. If you believe that this presentation will negatively impact you, we recommend that you choose to forego it. An eating disorder is an illness that is characterized by irregular eating habits, severe distress or concern about body weight or shape. Eating disorders can have extremely negative effects on one's mental and physical health. Some of the most common eating disorders today are as follows: bulimia nervosa, which is binge eating followed by periods of purging such as consumption of laxative, making oneself vomit, or severe amounts of exercise. Anorexia nervosa is when people view themselves as overweight, even if they're dangerously underweight, along with a severe restriction of food intake. Binge eating is when people consume large amounts of food in relatively short periods of time and feel a lack of control during binges. Pica is when individuals crave non-food substances such as ice, dirt, soil, chalk, soap, paper, hair, cloth, wool, pebbles, laundry detergent, cornstarch, and many other substances. Rumination is when individuals regurgitate food they have previously chewed and swallow, re-chew it, and then either re-swallow it or spit it out. And then avoidant restrictive food intake disorder is disturbed eating due to lack of interest in eating or distaste for certain smells, tastes, textures, temperatures, colors. It is often a misconception that only teenage girls suffer from eating disorders, but anyone can suffer from an eating disorder. Here are some facts about eating disorder. While eating disorders can affect anyone, there are a variety of biological, physiological, and sociocultural risk factors, including body image, dissatisfaction, weight stigma, personal trauma, and family history of mental illness. Bulimia nervosa, anorexia nervosa, and binge eating disorders have the highest mortality rate in any mental illness. Every hour, at least one person in the United States dies as a direct result from an eating disorder. Only 1 in 10 people with an eating disorder ever receive treatment. What is binge eating? Binge eating is usually consuming a large amount of food in a specific amount of time, such as over a 2-hour period. There's a feeling that your eating behavior is out of control, eating even when you're full or not hungry, eating rapidly, eating until you're uncomfortably full, frequently eating alone or in secret, feeling depressed, disgusted, ashamed, guilty, or upset about how much you've eaten, and frequently dieting, possibly without weight loss. People who binge don't compensate for their binge periods by consuming laxative, making themselves sick, or exercising excessively, such as someone with bulimia would. So there are quite a few reasons why people would binge eat, and there's not one specific reason, but there are a few causes. One such cause is family history. Individuals who have parents or siblings that have or had eating disorders are more likely to develop one. This may indicate that it's an inherited gene, which increases the risk of developing eating disorders. Many people with binge eating disorder have a history of dieting. Dieting or restricting calories during the day may trigger urge to binge eat, especially if you have symptoms of depression. There are psychological issues attached to many eating disorders. Many people who binge eat have disorders, and they feel negatively about themselves and their skills and accomplishments. This may trigger the binge eating and can include stress, poor body image, and the availability of preferred binge food. Eating disorders are extremely personal and they vary from person to person. So that to get a better idea about a personal experience with an eating disorder, I went on Reddit and I searched a few threads about binge eating, and this is a story I found on one of the threads. When I started working full-time and moved across the country, military, away from my friends and husband, I put on 30 pounds in a pretty short amount of time, approximately 7 to 8 months. Fridays after work were devoted to these epic binges. I would get 2 McChickens, 1 large fry, and a McFlurry on the way home and eat it all, often before I walked through the door. At home, I would have, this is seriously gross, a loaf of bread, a pack of bologna, and a pack of American cheese. I would eat all of it, like make sandwiches until the entire loaf and bologna and all the cheese was gone. I would eat that with a bag of tortilla chips and sliced avocado, like every Friday. I don't have any freaking idea how many calories it was. I know that the McDonald's alone was at least 2,000. The tortilla chips, 1,400. The bread, cheese, bologna, I don't even know, 2,000, 3,000. We're talking about 7,000, 8,000 calories in a 4 to 5 hour window, once a week at least. I would eat until I was physically ill. Like, I better lay really still so I don't vomit ill. I moved weighing 174 pounds in October. By May, I was at 204 pounds. It was so bizarre that I assumed the stress of moving manifested itself in that way. I still have a problem with binging, but not my binges are at 3,000 to 4,000 and happen once a month. From this story, we can see how stress can cause us to develop unhealthy eating habits in times of distress. The most difficult thing about binge eating disorder is that you can't quit cold turkey. Unlike alcohol, drugs, and nicotine, food is an essential part of your life, and you need to eat to survive. But recovery is not impossible. According to Healthline, setting a regular eating schedule and sticking to it is one of the most effective ways to overcome binge eating, as skipping meals can contribute to cravings and increase the risk of overeating later on in the day. Studies indicate that adding exercise to your routine could prevent binge eating. For instance, one 6-month study and 77 different people showed that increasing weekly exercise and the frequency of it stopped binge eating by 81%. Treatment for binge eating disorder can involve different types of therapy or medication to help get rid of binge eating and to treat any underlying causes or symptoms. Cognitive behavioral therapy is the most effective form of therapy, and it explores the connection between your thoughts, feelings, and eating patterns, and then develops strategies to modify your behavior. Bulimia has 2 different types, the purging type and the non-purging type. The most common type of bulimia is the purging type. In this form, individuals will regularly engage in self-inducing vomiting or abuse of laxative, diuretics, after a period of binging. And then the non-purging type is when individuals will use other inappropriate methods of compensation for binge periods, such as excessive exercising or fasting. In this case, the typical form of purging, such as self-induced vomiting, are not regularly utilized. The exact cause for bulimia nervosa is currently unknown, though it is thought that multiple factors contribute to the development of this eating disorder, including genetic factors, psychological factors, environmental factors, and cultural influences. Some of the main causes include stressful transitions or life changes, similar to how we saw with binge eating disorder. There could be a history of abuse or trauma. Negative body image is a large cause for bulimia. There's also poor self-esteem or professional and it says, finally, what I realized what I was doing was wrong. Realized how much it was hurting people that cared about me. Realized that I was killing me and I didn't want to die. It took me a long time to recover on my own, no treatment. But I ate out a lot with friends, the way I couldn't really run off and throw up. Plus, having them around was distracting and calming. Couldn't pinpoint the first thing to deteriorate because I was in constant haze. Weight and strength, muscle, wastage, concentration, all sense of enjoyment of life. My teeth became really, really soft, as said by my dentist, and I got a lot of cavities. My hair fell out badly, my skin was kind of dull and gray. I was always cold and could never sit up or sleep comfortably because of all of the bones sticking out. Even jeans rubbed against me and hurt. There is literally 0 things good about being bulimic, and the effects don't vanish when you recover. I'm still battling a host of medical problems that'll have forever, and I'm 7 years recovered. According to Center for Discovery and Eating Disorder Treatment Center, here are a few useful methods to overcoming eating disorders. Firstly, find ways to self-soothe so you can get past a moment of anxiety. For some people, repetitive tasks such as knitting or coloring can be soothing and distracting enough that the momentary anxiety melts away. Most people who recover from bulimia don't do it alone, so having a strong support system that helps along the way is very important. Building your network or support system is a crucial step on recovering from bulimia. And lastly, stop fixating over body weight, waist, and thigh size by getting rid of the weighing scale and measuring tape. We're constantly faced with a wide variety of information. In this presentation, I wanted to focus on the effect pro-anorexia pages thinspiration, and meanspiration have had on our generation. A study by Anna.org believes that there is a 119% increase in eating disorders between 1980s and 2006. I personally believe the media has a large role to play in this. The most prominent platform for pro-eating disorder content was Tumblr. Between 2009 and 2016, Tumblr was bombarded with blog pages that encouraged self-harm, giving different tips and tricks on how to make yourself vomit, how to suppress your hunger, and how to burn excessive amounts of calories in a short period of time. To get a better idea of what all this means, I've attached a few images from Tumblr. The first one shows a toilet with a little note on it that says "Time to fix today's mistake." This image is encouraging bulimic tendencies and is encouraging people to make themselves vomit in order to compensate for the food that they had consumed in the day. The next picture is a poster that says "Skip dinner, wake up thinner," and this is to encourage restrictive eating and meal avoidance in order to lose weight and get skinnier. This last post is called Meanspiration, and it's titled Meanspo 3. I guess it's a series of different articles or whatever you want to call it that are inspiring like anorexic behavior and bulimic behavior. So it goes, "Look at your pathetic self. How much have you eaten since you've lost enough weight to wear a bikini? 100, 500, possibly over 1,000 calories. What am I kidding? More than that, right? Considering how fat you are. Even the people around you are noticing. My, what did you think after you lost enough to look semi-decent in one clothing item, it's suddenly okay to eat like a pig? Wrong. Being pretty is something that stays. You need to work for it constantly. Unless, of course, you just want to keep eating all that food. How much fat was in it again? Enough to make you pile on more pounds, I suppose. And you're still eating despite everyone saying how fat you're getting. They probably think you're disgusting, looking at you differently because of all that mass you're adding to yourself." So that just shows some of the content on Tumblr that was very pro-eating disorders and encouraged young girls to follow these restrictive diets and excessive exercise in order to look a certain way. Large cause for this idea on thin being better and skinny being better is the fashion industry, and for a long period of time the fashion industry glorified one specific body type, which was tall, thin women with narrow hips. And a great deal of women look like this naturally, so it's not to say anything negative about this particular body type or any body type. It's just to say that the glorification of one specific body type that isn't naturally achievable by many greatly affects how young women view their own bodies. Adolescents tend to be highly impressionable, and constant exposure to material such as social media, television, and magazines that glorify and praise one body type while completely disregarding every other body type can have an extremely negative effect on how adolescents view their own body. Over the past couple of years, there has definitely been a movement to a more body positive and inclusive fashion industry, especially with the rise of platforms such as YouTube, Instagram, and TikTok, where women are showing off their bodies, and they all have different body types, and there's a greater sense of acceptance and appreciation of various body types. Among younger teenagers, there seems to be an appreciation for athletic-looking bodies, as exemplified by adolescent beauty icons today, such as Addison Rae or Charli D'Amelio. I think this is extremely beneficial because these girls, as you can see, seem quite athletic and they are body positive. They have various videos of them eating and enjoying their lives. And I think that's an extremely important shift